Big mouth has some big problems, and that's putting it mildly. That's why today we're going to be reacting to and breaking down all of the crazy medical type situations and drama that happen in the Netflix fave Big Mouth. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. If you enjoy the educational reaction videos here and the other stuff that you see on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
What to do if my penis is too small?
It was the fourth one down. Oh my gosh. Wait, we got too crooked, too wide, too fast, too furious. This question reminds me of my whole series on the embarrassing question series that I make multiple videos about. Comments, DM, email, and we'll answer those questions. And maybe I'll include them in the next video.
It's a vacuum.
What are you doing? Cleaning up?
I'm gonna put it on my dick to make it bigger.
Oh my gosh, please do not do this. Don't do this. There are many times that I've seen people come in with different devices stuck to their penis. You can lose your penis. It could fall off. It could turn black and die and just fall off. Most of the time, the individual thinks that their penis is too small, when in reality, it's just fine. Oh, no, bad idea, take it off, turn it off. Oh my gosh. This is horrible. Bad idea. You're gonna cause potential ischemia to the tissue, decreased blood flow. He even said that his balls got sucked inside. There's all that suction pressure, decreasing enough blood flow to the area that long-term injuries could occur. I can honestly say I've never seen somebody come into the emergency department with a vacuum hose stuck to their penis. I've seen condoms stuck. I've seen Coke bottles stuck on a penis before. It actually causes issues and can decrease blood supply to your penis, and then you make it turn black and it dies, and then you don't have a penis anymore.
Are you having a panic attack?
What? Who said that?
Me! I did!
Oh!
I'm sorry, people hate it when I do.
What happens when you do get a mosquito bite? Every mosquito bite is not harboring disease. You can take an anti-inflammatory, you can put ice on the area. Sometimes there are topical different oils, such as like peppermint or a brand called Skin So Soft, help deter mosquitoes from biting you.
You're gonna know you're a selfish little who has a little that nobody was.
Oh my
God!
God.
Virgin all alone.
Poor guy.
I don't want to be a dead, lonely little
Poor guy.
virgin.
I'm assuming this is an internal dialogue that Nick is having relating to the fact of anxiety, and it just perpetuates itself. It's so hard to get off the anxiety train. A lot of times people will come to the hospital and to the ER for anxiety or panic attacks because they're having chest pain and they feel like they're gonna die. And then we could say, okay, it's probably most likely a panic attack or anxiety attack. Ultimately, to be able to treat it long term, you really need to get to the root of what's causing it. But temporarily, we can use different medications. Sometimes an ER doctor will provide benzodiazepine, which will help calm the situation down, but it's not an everyday, all the time medication. It's more of a rescue medication.
Jesus, those scissors are huge.
Those are big scissors.
You're cutting your pubes, not opening a grocery store.
Not making me nervous.
Oh, no,
Oh
no,
my
no!
God, I nicked my sack. My balls are gonna slip through the hole.
Oh my God, please be careful when trimming any hair around any genitals. The skin is very thin because it's for sensation. It bleeds like crazy because it's a highly vascularized area.
Where are the Band-Aids?
Oh, you've got some Paul Mitchell mousse.
Wait, what's this? Nair.
Nair, don't use Nair. Nair is a type of chemical that you put on to remove hair. Do not put it on an open wound. Do not put it on your genitals. It burns hair away. It's gonna hurt the skin even if it's not even open. Infants will get hair wrapped around either their fingers, their toes, or their genitals, and you actually can't get to it and cut it, but if you put some Nair there, it'll actually burn the hair without injuring any of the other tissue.
Ah! What the f was that?
Hydrogen
On
peroxide.
the hydrogen peroxide. So hydrogen peroxide is very good on an initial injury to clean out any bugs, bacteria. Continuously doing it after 24 hours will actually inhibit wound healing. Typically, just wash it off. Just use water, tap water, wash it off.
Your dick is Jared Leto and Joseph. It's the Chodker.
The Chodker.
Why so serious?
The choker. But that laceration underneath looks horrible. It needs to be sewn shut. What was he thinking? The worst things I typically see relating to that actually is something called Fournier's gangrene. I've had patients where the testicles are just hanging out because the treatment for Fournier's gangrene typically has to do with debridement of tissue. The testicles need to be saved, and you actually make pouches where you actually put the testicles.
It's just blue balls.
Oh, God, I'm sorry. I'm sorry.
Oh,
Am I doing
blue
something
balls.
wrong?
I mean, you turn me on, but then I don't get to, like, you know, finish.
Let go.
Right.
Oh my gosh, blue balls, very painful. Nobody's ever died of blue balls. I know sometimes people feel like they want to die. The medical term for is epididymal hypertension. The epididymis is like the storage next to your testicle, the softer spot. And hypertension increases a lot of pressure. So it's ready to go, but it doesn't release. So it causes a lot of discomfort and pain in that area. Does it actually turn your balls blue? No. Myth debunked.
It's fine. It's just this excruciating pain in
It
my
feels like
legs.
you've been kicked in the testicles, basically. Hence, that's why it's holding his abdomen.
Do you want to go to urgent care?
Yep, there you
I
go.
guess there's one thing we could try. You could, you know, give me a hand job.
Oh,
Do you want to go to urgent care? No, not really gonna be able to help. We'll maybe give you some Tylenol or some ibuprofen.
These blue balls are about to explode.
I don't want to die. I have kids.
Yes,
It's the blue balls ward.
the blue balls ward. We do not have a blue balls ward at the hospital.
Cause of death, Jessi Glazer.
Oh, that's disgusting. But this leads us into what I actually do see. Testicular torsion. Bad. Get to the hospital. If you start having unilateral testicle pain and you notice that your testicle is higher riding on that side, get to the hospital. Thymus testicle. No joke. The less blood supply it has, and then it becomes ischemic and potentially could die. It's a surgical emergency. Urinary tract infections can sometimes cause discomfort. Prostatitis, which is an infection of your prostate, can sometimes cause testicular discomfort. And then trauma. So sometimes you just need pain medicine or antibiotic. Don't hide it. Don't, just wait for it to go away on its own. Like, get to the hospital.
Nikki, I knew you would have been so embarrassed if I didn't come and tell your entire sex ed class about my decision to get a vasectomy.
So what is a vasectomy? You have a surgery where you clip the tubing related to the testicles so sperm cannot escape. Still ejaculate and still have pleasure during intercourse, but the sperm won't follow.
wow, Dr. Birch, you're a real partner in family planning with your wife.
Well, Mrs. Birch's birth control was robbing her of her natural moisture.
Oh my gosh. Imagine your parents talking to your friends about this. Birth control is hormone therapy, basically. So there are other treatments out there. You can use an IUD, which is placed inside the uterus. Then you can actually have an implant within your arm, or you can get injections. At the end of the day, if you don't have to put something in your body, that's probably better. There's just multiple options depending on your own life situation. Big Mouth, these clips were awesome. These were pretty darn good relating to medicine and what the next step is and what to do in these different situations. If you guys liked my reaction to this, check out this series right here. I know you're gonna love it. And as always, make sure you subscribe, turn those bell notifications on. Thank you so much for watching, and stay healthy, my friends.